Hi, my name is Sid Govindan. I'm the Vice President of Clinical and Provider Innovation here at eviCore. In college, I was a computer science major and also did pre-med, and I'm board certified in diagnostic radiology. I continue to practice radiology part-time, working in the hospital in the emergency department. I joined eviCore after its acquisition of Cupid Health, a startup company of which I was an original member. At Cupid, we worked to develop technology to help physicians find information that was often buried in the medical record, and we used technologies like natural language processing and search. I joined Cupid after finishing my radiology training, mostly out of an interest in entrepreneurship as well as the application of technology in healthcare. I continued my clinical practice to keep current with medicine, as well as to maintain a perspective while often working on the other side of healthcare here at eviCore. In my role at eviCore, I work with different product teams, developing innovative solutions to expedite prior authorization processing. This has included the application of some of our artificial intelligence technologies to help both with the submission of prior authorization from the provider side, as well as to expedite the processing internally at eviCore, both as part of the intake as well as the clinical review process. This technology is a movement in the direction to reduce burden for those cases that should clearly be approved, and sets our intention to address some of the critical healthcare burdens that providers face. As eviCore serves a needed role balancing utilization against appropriateness, it gives me satisfaction to know that we are addressing it from the perspective of an already overburdened physician, or from that of a patient not wanting to have a delay in their diagnostic tests or their treatment, or worse yet, having to deal with insurance companies at a low or possibly the lowest point of their life. We have a ways to go and a lot more to learn from our provider partners, internal subject matter experts, and countless years working with payers, and I look forward to our continued product innovation and development as we set out to address some of healthcare's largest burdens via our unique position in a fragmented healthcare system.